America's leading skeptic, John Ziegler, joins us now with the 10 most important COVID-related questions which the news media is ignoring. Welcome to the program, John. How are you?
I'm all right. Always good to talk to you, Glenn.
So we published this at glennbeck.com because I think these are important questions, and you have provided some answers to them, and no one is willing to ask these questions, let alone answer them accurately. So can we go through them?
Yeah, sure. Well, first, just for some background, I mean, I'm a senior columnist at Mediate, and I submitted this to Mediate. I've had a very good relationship with them for 5 years, and I actually pulled it from the process because I have learned now in COVID that this is beyond a third rail issue, and that there are certain things now that are almost impossible to discuss in the so-called mainstream New York-based media, and I knew that this was going to be eviscerated via the editing process, and I said, you know what, let's not do this. I didn't want to get into a big fight. I wanted to maintain the relationship, and so I asked you, hey, Glenn, maybe you could find a home for this.
Yeah, absolutely.
And thankfully you did. So yeah.
It's at glennbeck.com. By the way, there is also the raw report on the voting machines in Michigan. The raw report is what you should read because the stories I read today, they all said, well, that's taken out of context and that's not really what the report said. So read the report. It's posted at glennbeck.com, and so is this. And this is really important. When we live in a society where you can't ask questions, there's a real problem with freedom in that country, and it's only getting worse. So let's go through some of these.
Yeah, well, I start with, what does the recent surge in cases say about the effectiveness of lockdowns? This seems like a pretty simple question.
Sure does.
I start this column by admitting that, I, along with a lot of the people who thought in late September, October, that maybe there was such a thing as low threshold herd immunity, and that maybe we would hit this sooner than thought by the so-called experts. I admit, hey, guess what? Looks like we were wrong. But why doesn't the other side get forced to at least examine whether or not they were wrong about the issue of whether or not lockdowns are effective?
Well, you're seeing lockdowns and between 91 and 97% mask wearing, especially in these states that are really locked down. But you've got a 91% or 92% mask wearing with the population. Here in Dallas, it's higher in other places. So how could you be in lockdown, be wearing masks, and tell me that those things are effective when the numbers are going up?
Not just a little bit. I mean, these numbers are one of the things we've learned is that, guess what? During the summer, this basically barely existed. I mean, in comparison to what we have now, if you believe totally in the data, now there are problems with the data. That's another question that the media won't answer. But we have no introspection at all as to whether or not the most recent surge eviscerates the entire concept of lockdowns, and that leads to the second question: is what's the collateral damage of these lockdowns? You know, Glenn, I have 2 young children. I thought we were living in a society, mostly for better, sometimes for worse, where it's all about the kids, right? Mm-hmm. All about the kids. That has been completely abandoned and forgotten for the last 10 months. Much of what we're doing here is literal child abuse, whether it's keeping kids out of schools and all sorts of other things that we're not. Almost everything we do within a lockdown targets kids. Anything that's fun, apparently, the COVID really targets. That's one of the things I've learned in the last 10 months. And so we never talk anything in the media about increased suicides, increased child abuse, increased drug abuse.
No. I have read in mainstream sources that there is no suicide increase. All of this stuff is nonsense. I've read it.
Yeah. Well, there's been all sorts of both data points as well as specific stories that in a normal media environment would have caught fire. You know, where people would have rallied to the cause. Whoa, what are we doing to our kids? But that has been verboten here because it makes people question the narrative. And you know how nervous I get when people in the news media dive into and get emotionally invested into a narrative early on, because then there's no going back. And I predicted early on with COVID that's what would happen here. And the most you've already referenced it. To me, the most bizarre element of this entire narrative, and this is a tough battle to pick which was the most bizarre, but the investment in masks by the mainstream news media is just so strange, given the fact that, St. Dr. Fauci said in March that they don't work and that people shouldn't be wearing them, and that this was the conventional wisdom among the scientific community. And I predicted on your show a couple months ago that the whole mask thing would be the cover story that the left uses to show that they were able to finally defeat the virus. And Joe Biden has vindicated that by declaring we're going to have 100 days of mask wearing. 100 days, by the way, very sciencey. That's a very sciencey number. Very, very sciencey number that he picked out of his backside. So why is there no questioning why masks are not helping in the data? Not just recently, but there are literally hundreds, and I'm sure you're aware of this, and probably most of your listeners are, there are hundreds of data charts from not just around the United States, but around the world that make you not just question whether or not masks work, make you question whether or not masks are actually harming us with regard to the data. I mean, I can't find one. Now, there's been a couple they've tried to manipulate and cherry pick. One in Kansas, Arizona, Tennessee, but those are easily explained as being incredibly weak sauce. Why are masks not helping at all? And the media is simply not going to ask that question, because let's be clear why. Because the woke world dove into masks as a virtue signal against Trump. And once that happened, it was all over. Because now the left-wing media, mainstream media, is controlled by woke Twitter. I mean, woke Twitter basically edits the New York Times now, as insane as that is. And so once that happens, you are not allowed to say anything. That Danish mask study comes out and says basically masks do nothing. And the New York Times changed their headline to say, well, the study says they don't really work, but you should still wear them anyway. That was actually in the headline, Glenn. I mean, that's the level of insanity here. And so that's one of the big questions the media won't ask. And then one of the ones that I probably one of the few that have written about, and I did so early on at Mediate because I live here in California, and it never made any sense to me. How in the world, considering all our connections to China, specifically in Los Angeles and San Francisco, that California would have been one of the last states to have a major outbreak here? How is that possible? And so my question is, if COVID was around way before March, what does that really mean? Well, we now know from all sorts of sources, including a Red Cross blood test study, that this thing was here in December. And by the way, anecdotally, I had hundreds of people tell me that they thought they had this in California in the December, January area. Yep. And so what does that mean? Why won't we at least ask that question? My gosh, here in California, Glenn, the entire month of February in the Los Angeles area were Kobe Bryant memorials, where people were hugging and kissing. And I mean, there was an indoor massive memorial on February 24th, and nothing happened. No, nobody even recognized anything. Nobody knew anything was happening. We had the Los Angeles Marathon. I think it was March 7th or March 9th. Then the state closed down a week and a half later. I mean, this is a question. I don't know what the answer is. Maybe it took a lot longer to spread than we think. But shouldn't somebody be asking what this means? That we just went through an entire winter where this was circulating and nobody noticed?
Here's the one that I think that you asked that is really important, because it's the mask thing. They're saying now, even if you get the vaccine, you need to wear the mask because the virus could live in your nose and you'd be asymptomatic and it will spread.
Glenn, you have put your finger on the most maddening element of well, there's so many of the vaccine questions. And by the way, I'm going to be on Bill O'Reilly's show later today talking about the vaccine element of this. The idea that somehow the vaccine changes nothing. This is the narrative that they're now spreading, that we still have to do the mask thing. We still have to do social distancing because you can still spread it. When, by the way, and one of my questions is, what's the real evidence of significant asymptomatic spread to begin with, even without the vaccine? I mean, Fauci said in January that that's never the driver of a viral spread. What happened to that? Almost everything we do is about the potential of asymptomatic spread. There was a study out yesterday indicating asymptomatic spread is very, very low and very rare, just as the World Health Organization said, and then they had to walk it back because it was so politically incorrect. But what you just said is so important, and to me it proves this is about governmental control. They told us we had to wait for the vaccine, and no, even the vaccine's not going to be good enough. Because, by the way, the math on this, if we were doing even third grade math, we would know that if everybody over the age of 55, or even 70% of the people over 55 got a vaccine, this thing is over. It's over because there's not going to be any significant level of death, assuming that the vaccine is anything close to as efficient as they say that it is. And right now I have no reason to doubt that. I hope it is. But that's just remarkable to me because that leads to the next question, which is, what is the average age of COVID death? And this almost gets, it's very serious, but there's a comical element of this. I mean, when you Google anything, Glenn, as you know, you can Google the most ridiculous questions in the world, and Google has an answer right there for you. If you Google what's the average age of death in America for COVID, you don't get an answer. You literally do not get an answer. You get a link to a CDC chart that still doesn't give you the answer. You have to surmise what the median. You can't even get the average. You can get the median, which is about. It looks to me like 79 or 80, depending on how you do the math. And by the way, in many specific states who do give you that information, it's higher than 80. In many countries, it's as high as 86. That ought to matter. That ought to be the second question. How many people are dying because of this? The second is, how old are they?
Yes.
I mean, because the average age of death in America is 78 years old. I'm sorry. When the average age of death of a virus is older than the average age of death, period, that's a significant fact.
Yeah. So hang on just a second, because I've got to stop you. I have a network break. I want you to answer one more question. I've got about a minute for you to answer it. All of these questions and all of these answers, there's more, are posted right now at glennbeck.com.